The United Kingdom relies on two massive pillars to keep its citizens from falling through the cracks: the welfare system administered by the Department for Work and Pensions and healthcare system run by the National Health Service. Over the last decade, lawmakers have passed a series of sweeping legislative changes aimed at both systems. The stated goal was to modernize outdated bureaucracy, cut costs, and streamline government services. The Welfare Reform Acts and the Health and Care Act shifted decision-making power out of local communities and consolidated it into distant, opaque service centers. This separation between the center and the community is known as administrative distance, a structural gap where policy decisions are physically and legally removed from the people they impact. To see how this works in practice, we have to look at the front lines. A local job center is often a citizen's first point of physical contact with the state's safety net. But the people working inside this building don't hold the final authority. When a purely administrative error occurs, like a processing blockage hundreds of miles away in a Belfast service center, a vulnerable person's subsistence support is suddenly cut off. The local staff can clearly see the citizen facing severe hardship, deprivation, and an impending physical crisis. Yet they lack the statutory power to override the distant computer system and reinstate the funds. By stripping away local context and human judgment, this highly centralized structure pushes citizens to the brink of financial and physical collapse, while leaving the local workers completely powerless to stop it. When a financial collapse like this happens, it immediately worsens any underlying clinical vulnerabilities. The citizen has no choice but to turn to the other pillar of the state, the National Health Service, for a statutory lifeline. But the NHS offers the same structural barriers. Following massive mega-mergers in 2022 and 2023, healthcare administration is now just as fragmented and geographically distant as the welfare system. When local social workers try to secure help, they find themselves trapped in bureaucratic silos. They are forced to deflect responsibility to distant care coordinators. The legal duty of care becomes a hot potato, bouncing between primary care, urgent care, and mental health trusts without ever landing on a single responsible party. When these centralized systems overlap, the collapsing citizen effectively becomes the coordinator of their own survival. They are forced to navigate a maze where no single entity accepts legal responsibility for their entire pathway of care. This raises a serious question about government oversight. How is a cross-system failure on this scale legally permissible? The answer lies in how the state altered its own reporting laws. The Department for Work and Pensions removed previous income-related child poverty targets, replacing them with a life chances framework that effectively changes what the government is legally required to see. The healthcare system operates with a similar blind spot. Following its recent mergers, the NHS currently lacks a formal, systemic mechanism for tracking and implementing patient safety recommendations across the board. The state has legally blinded itself. By deleting its own tracking data and ignoring formal warning mechanisms, it avoids having to acknowledge the measurable damage its policies are causing on the ground. The failure of these two systems is currently impacting millions of people across the United Kingdom simultaneously. This visualization shows the sheer scale of the exposure. Right now, over 1.6 million children are subjected to the DWP's two-child limit, with a massive portion of that number overlapping directly with households relying on disability benefits. If we track this specific cohort chronologically, we see a clear pattern. The children who were exposed to the tightening of welfare policies starting in 2016 are the exact same teenagers who are now crashing into the fragmented NHS. The clinical outcomes of this timeline are stark. Among 17 to 19-year-olds, the prevalence of probable mental disorders has jumped drastically, rising from 10% to 23.3%. At the same time, we're seeing a 37% rise in hospital admissions for self-harm among 15 to 19-year-olds. The state's highly centralized welfare policies are actively manufacturing trauma, and its equally centralized healthcare policies are too fragmented to effectively treat it. This compounding crisis degrades the United Kingdom's future human capital. When a large child population is exposed to prolonged instability during their formative years, it threatens the long-term resilience and productivity of the entire country. Despite these structural failures, the government is proposing yet another massive reorganization of the NHS in 2026, which threatens to introduce even more complexity into an already broken system. To stop this cycle, researchers and parliamentary committees are demanding a definitive solution. Parliament must mandate a formal constitutional impact assessment before any further consolidation is legally allowed to proceed. This assessment forces the government to explicitly map out exactly who holds the legal duty of care and how citizens are protected before any more boxes are moved around on an organizational chart. The state must be forced to prove its systems actually protect people before it is allowed to legally redesign its accountability away ever again.